Hi, my name is Cody.
And I'm Grace.
We're going to talk about strokes. So to start, what is a stroke? Strokes come in two different variations, but the principle between the two is the same, which is that the brain is not receiving blood and the brain suffers from hypoxia as a result. The two different kinds of strokes are hemorrhagic and embolic strokes. With hemorrhagic stroke, which occurs in about 20% of cases, arterial blood vessels rupture and a bleed develops inside the brain. This bleeding does two things. It decreases the amount of blood reaching the area of the brain which the ruptured artery feeds, and it can also increase the intracranial pressure inside the brain. The other type of stroke is an embolic stroke. With embolic stroke, the blood flow to the brain is blocked by a blood clot or is occluded by atherosclerosis. This type of stroke is more common and occurs in 80% of stroke cases.
The risk factors for stroke are similar for both kinds. We'll look at the non-modifiable risk factors first. Age, ethnicity, gender, and hereditary factors are all non-modifiable factors. Older people are more likely to suffer from strokes due to their arteries becoming brittle with age. In the United States, Black individuals are more likely to suffer from strokes than all other groups. Men are higher than women. Higher risk. Men are not higher than women. Men are higher risk than women. Some risk factors are modifiable, such as smoking, alcohol intake, obesity, level of activity, hyperlipidemia, and sodium intake. These modifiable risk factors are where patients can have the greatest impact on their health. Smoking cessation, decreasing alcohol intake, and establishing an exercise routine with a low-fat, low-sodium diet can reduce risk for stroke.
In recognizing stroke as it is occurring, we like to use the acronym BFAST, which stands for balance, eyes, face, arms, speech, and time. Patients suffering from stroke will often have one side of their body affected, while the other half of their body works as normal. They will also show facial droop and have slurred speech. If you recognize a stroke as it is occurring, note the time as soon as you recognize the symptoms to give healthcare providers as much information as you can about the time course of their stroke.
Diagnosing a stroke is largely done with a physical assessment. The care team may choose to do a CT scan of the brain to see if the stroke is due to hemorrhage, which will show up on the CT scan. Embolic strokes will not show up on the CT scan until the brain tissue has already begun to die, so the care team will rely on their physical assessment to diagnose an embolic stroke.
Strokes are medical emergencies, and treatment needs to begin right away. For embolic stroke, the care team may use a thrombolytic drug called TPA to dissolve the clot that is blocking blood flow. For hemorrhagic stroke, the care team may allow the bleed to run its course while implementing supportive therapies to manage bodily systems, or it may choose surgical intervention if the bleed is severe enough. Rehabilitation may be needed after the stroke has subsided to help the patient recover lost mobility and to help them swallow properly to avoid aspirating food or liquids into the lungs.
Thank you for your time, and remember, be fast when you recognize a stroke.